Okay, yeah, okay.
Okay.
Hey everybody, sorry about that. A couple of minutes late. I forgot to hit the go live button. I started the show, and yeah. So anyway, we'll start now. Hopefully everybody can hear me. If you could just comment below and just let me know that you guys hear me loud and clear. No comments. Let me just post a comment here. Can everyone hear me? Okay, cool. So let's go ahead and start. So I'll start with the comments and then I'll go into the statistics here. So Dimitri, he says, hi to you both. I do agree 100% with you, Paul. These lockdowns for everyone don't make sense. Let me put, don't make sense at all. But it's interesting that it's in the same in almost every country. They got all crazy, or why is that so? And let's see. Bamsemoy says, Dimitri, there is the answer. And GI says, good morning to you from Ohio. Good morning, GI. Nice to have you with us. And Mame say, yes, they can hear, you guys can hear me, so that's great. And then loud and clear. Okay, so I haven't done this before, but let me see if I can do this, how this works. So share screen, I think this one here, share screen. So let's see. So what I really wanted to look at here was um, the death rate, and um, this is statistics from New York, and I would guess it's somewhat similar in most parts of the world. However, I didn't find any statistics specifically for the Philippines that breaks it down this way. But um, my big thing here is that if you look at, for example, from 18 to 64-year-olds, um, you get a 0.8% death rate and a 3.7 death rate. However, and this is the big part here, uh, there is 601 cases that equates to 3.9 in this specific sample. And out of that 601 cases, 476 people um, are have underlying issues. So um, that would mean that this number here would be approximately, just a quick calculations in my head, would be about a fifth. So maybe 0.1, 0.2% at 18 to 44. And then at the 45 to 65, it's almost 3,000 with underlying issues out of 3,400. So again, that would put you down to here, would put you down to roughly, let's see, about 0.7, 0.8%, quick calculation in my head. So again, that shows you that, I mean, this is a serious virus, but I think the seriousness depends on your health condition, obviously. And I think the way we're approaching it is completely wrong. So, but before I continue, um, does anybody here want to join that has any healthcare experience or works in a hospital or knows people that work in hospital, you're more than welcome to join. I'd love that. We could have a more of a discussion. Um, Sean says, he hears me loud and clear. The spider during your hike is more deadly than the COVID-19. Probably. I don't know about that specific spider. Let's see. Rick says, if you can zoom in on the browser screen, we can see your statistics better. Click on the three dots in the upper right, go to zoom and increase the size. Um, okay, just let me do this. I know what Rick is talking about here. So I go. Now you can see this pretty good, yeah? So what I was talking about here, Rick, was how many people have underlying issues in these statistics. And that's very, very high. Another thing that is not here, but I've read on a different research paper is that 96% of, was it 96 or 93? 90+% of people going into hospitals have a severe lack of vitamin D, that have middle to serious complications with the corona. So there is something to being healthy, having your blood levels checked, making sure that all your vitamins and minerals and all that are in order when you do your blood level check. Um, so thanks, Rick. I'm a slow starter, especially in the morning. So yeah, but I did have some interesting comments yesterday from the video, and one of them said the following, and I didn't really think about this. He said one of the reasons for the lockdowns from island to island is probably because of mutation. They are worried about not so much about people dying, but maybe about the virus mutating and us getting a new strain that is um, more deadly uh, and less like the vaccines will have less of a chance of killing it. So I guess I can see the reasons for the lockdown. I just think it's gone on for very long, and I think it's time to start letting people. I mean, looking at these statistics, at least these under 45, 50 years old with no underlying issues do what they want to do. In the end, like I was saying in the video, it's your own life. Yes, I can understand the part with the virus mutating. If you spread it, every time it spreads, there's a chance of mutation, right? So, um, let's see. P.S. says, Paul, are you going to take the China-made COVID-19 vaccine or wait for the one of the American vaccines? No, I'm not taking anything from China or Russia. I'm going to wait. Probably take the one from the US or the one from England. Bamse Moy says, it should be clear to everyone that can think for themselves. This is the biggest hoax in human history. I don't know if I agree, Bamse. I think they've pushed it too far, maybe. They've hit the panic button. And once politicians, it's kind of a power grab, maybe also because they can manipulate more with scaring people than giving people hope. But now that the vaccine is coming, I mean, what do you guys think is the future? I think everything goes back to normal by the fall of 21, because if it doesn't, I think there'll be a revolution in many countries. I don't think people are going to put up with this much longer. Roy Good says there was a big news story that up to December 2020, the people with no health problems under 60 years old that died of COVID was only 388 in the UK. Yeah, I think the UK had something like 100,000 deaths so far. Is that right? I'm just going off the top of my head trying to remember, but I can look it up. But I think if that's right, that's, oh my God, yeah. So basically, being unhealthy is the cause of many deaths. And in the U.S., we have a problem with overweight people, and people that eat unhealthy. So maybe that's why there's so many. And also the average age of this is something I didn't look up. The average age of the people dying, it's very high. Let's see here. It was before I could click on the country. They keep changing these websites, so here it is. Um, USA, UK. Yeah, 106,000 people dead in the UK. So if that is right, with no underlying issues, as Roy says, that's yeah, that says a lot. Does anybody know the average age of people dying? Death rate, incubation, age. Let's go to age. Let's go here. Actually, let's just go age. Kaplan says, I think the problem is that the healthy people live in houses with vulnerable people. You can't stop it spreading within a house. Yeah, that's true. Now, if you do live with people who are vulnerable, you obviously have to take more precautions. But a lot of people live alone, especially in the West, or they live with their significant other, which typically is in the same age range in the West. Um, so the the biggest age range is 75 plus. So that's about 50%, and another 25% over 65. So basically, 75% of the people dying are over 65. So, and then looking at the numbers quick here, it must be over 90% with underlying issues. But yeah, so John says, I'm 58 and I've got underlying condition, maybe more than one. Don't care. Let me take my chances. Everyone's so busy trying to stay alive and no longer living. I'm done. You know what, John? I kind of agree with you. Um, the only reservation I have is when you do go out and if you do have the virus and you do spread it, every time there's a chance of a mutation. That's somebody who mentioned that in my comment, and I hadn't thought of that, and that I thought was a really good comment. So, but I do agree with you. It's just like riding a motorbike, right? A lot of people here ride it without helmets. I wear a helmet. That's my choice. You know, it's a hassle to wear, but I'm saying to myself, the hassle is worth, you know, the extra chances I have of surviving if I do have an accident, right? So it's the same way with the corona, I think, and it's your own body, your own life. So people should make up their own mind. And I think after this year, I just don't see this going on much longer than the end of this year. This will only get better when the whole world gets vaccinated. Yeah, that's true. And you know what surprises me about that is I thought by the time we were into the vaccines, which is now, people are getting vaccines, they would come up with some type of system where they say, well, if you've had the vaccine, you can travel, but there's nothing like that. It's still everything. Whether you've had vaccines or not, you're still under the lockdown rules. So it doesn't make sense. That doesn't make sense to me. Capron, at Roy Goad, I think there's something like 30% of the UK population who are vulnerable. I don't know what it is in the US, probably higher. But you know, the advantage of England and the US and the Western countries is that we do have a really good healthcare system compared to the Philippines. So if we were seeing the same type of numbers in the Philippines uh, of the spread of the corona, I wonder what the death rate would be here. But then again, most of the life here in the Philippines is a kind of an outside life in the sun and vitamin D and all that, like I covered before. So maybe the death rate wouldn't be that high. Richard says, has anyone heard of any person dying from the flu in the last year? That's a good question. Well, I would think this is just my theory, but I would think the amount of people who die from the flu last year and this year will be less. And the reason I say that is because we were social distancing, we were wearing masks, we were under a lockdown. So to stop the spread of COVID, so that would also stop the spread of the flu. I can tell you I've been a lot less sick this year, last year than the year before. I think I was sick once last year. So Capra in the UK says, in the UK, I think the median age of the COVID death is 85. Oh, really? Wow. Yeah, I saw this on a news station from the US. I don't remember which one, but they mentioned when the death rate came up to 400,000 that more people had died in in 1 year from COVID than had died during the Second World War. In the war, Americans in the war. I mean, like soldiers in the war during the whole Second World War. But what they didn't mention was that the average age of people dying in the Second World War was 23, I believe. And um, like Capran says, the average age of people dying from corona, I'm not sure what it is in the US, but I'm sure it's over 70, if not over 80. So that's a big difference too, what the average age is. If somebody who's 75 dies, we feel sad, but if someone who's 23 dies, we feel pretty distraught about it. It's like the person hasn't lived their lives yet, right? So Bamsamoy says approximately 1.35 million die each year as a result of road traffic crashes. 1.35 million. Oh, you're talking the whole world. Yeah, I can see that. I don't know if they have any statistics in the Philippines. I remember looking for it once a few months ago. I couldn't find it. So if anybody has that statistics, I'd love to have that. Um, the mean is about 81. Uh, I think Kaplan's talking about the UK. So um, I'm sure it's in here somewhere in this website, but let's see. No, I don't have any average age. I guess I could put all these numbers in and get an average age, but they only go up to 75. So, um, oh, here is another age statistics. Here it is. Death rate 80 plus is 14.8%. This is the death rate. So above 80, you have a almost 15% chance of dying if you get the corona. Uh, between 70 and 79 is 8%, and 60 to 69 is 3.6, and 50 to 59 is 1.3, 40 to 49 is 0.4. I believe the flu is about 0.1%. So again, below 50, we start seeing the numbers are very small. And this includes people with underlying issues. So you can divide that number with about 5. So, you're looking at under 0.1% for 40 plus. And what would that be? Divided by 5 here would be 0.04% for 30 to 39 people without underlying issues. So again, not a very big number. The thing is, do you want to put your life on hold for 2 years, or do you want to take the chance? Me, I'll take the chance. But like I said, there was a good comment yesterday about the spreading of or mutating corona. Dimitri says, in Germany, the median age of COVID death is about 82. Well, wow. So that is, what is the average lifespan in Germany then? I wonder. It must be 85 or so, I'm guessing. So really, they're not losing many years of their life. I guess that's what you're saying. So yeah. So And so what's happening here in the Philippines is they are they have a new strain that's coming out like the rest of the world, and I think they're panicking a bit about that. So they're saying they opened up for up to 10 years old to go out, and now they're saying 14 and below have to stay home. But the strange thing is when I go out and do Maggetti, it doesn't feel like we're under restrictions anymore. Um, we still have to wear the mask and the face shield many places, but most people have their face shields instead of like this, they have it up here so they can breathe. And then, like before, when you stand in line, we had to do the social distancing. We're supposed to still do it now, but people just cramp up together in front of the guards, and the guards say nothing. And all the restaurants are pretty much open, the ones that didn't go bankrupt, and they're trying to survive. So things are getting back to normal. I just hope it doesn't go back to shut down again. Oh God, that would be hard. So Rick says maybe this is what you're looking for about Filipino traffic death is 2018. This is what you're looking for. Uh, Maybe you're supposed to send a link there, Rick. I don't see a link. So I don't know. Maybe it's just on this StreamYard. Let me go straight to the let me go to the YouTube directly and see. Let me just check this real quick here. Okay. Yeah, I don't see the link. But no matter. If you want to send me that link later, that would be great. See, Capron says in the UK, when the outbreak started, they discharged all old people from hospitals into old people's homes without testing them. This caused COVID to spread through nearly every old people's home. Wow. That wasn't very well. Yeah, in the beginning, they made a lot of mistakes. Like, really, really wasn't thought through. And the same here in the Philippines. They came up with these weird regulations. Like, I remember the one with the you had to have this plastic shield barrier between you and the person behind you on a motorbike, even if that person was your live-in partner or your wife. And that was beyond. It's only when the rest of the world started laughing of them, and I think a couple of people died because those plastic barriers caught some wind and the guy behind went flying, I guess, and there was some death from that they changed the rules. But man, some of the stuff they do, I wonder, like, who thinks this stuff through, really? Mr. Vega says all of these stats are skewed because they are counting people who die with COVID, not from COVID. Everyone is blaming COVID, but it's actually a consequence of decades of unhealthy living. You know what? I've had that discussion, Mr. Vegas. That's an interesting discussion because I've seen that comment before, that reasoning before, and someone said like this: they do the same with HIV, for example. If you get HIV, you die from underlying issues. You die from the flu. You die from cancer, you die from something that's underlying, basically. And the reason is because your body's gotten so weak because of HIV. And it would be the same with COVID, maybe, that your body is so weak from COVID that you die because of those underlying issues. So, what do you counter that as COVID or underlying issues? You probably wouldn't have died of those underlying issues if it hadn't been for that COVID, is my understanding anyway. So I don't know if the death rates are accurate or not, but I think they're as accurate as they can be. I don't. There's a lot of people working with this stuff, and I don't think. I mean, I know nurses in the U.S. and they tell me they're swamped, and this is not a hoax. So, but again, it is to me, it's more about a personal choice. It's more about um, do you want to take a chance? Where do you live and what age group you're in and all that. And also, it depends where you live. If you're living out in the country, why do you need to be locked in, right? I mean, if you're living in a city, the possibility of spreading the virus is much, much larger, obviously. I agree with you. I'm 44 from the UK, but some younger people are being hospitalized and surviving it. Yeah, but with health complications still 10 months later, we still don't fully understand this virus. Yes, that is true. Some younger people are having issues, and some people are in the hospital for a long time. And biologically, we're also different. I read somewhere else that depending on your blood type, um, some people are more prone to have complicated issue versus other blood types. So there's a lot of variables in there. But I guess my point is that it's still type of a personal preference what you do with your life, as long as you're not affecting other people, right? I mean, I can't say I don't want to drive with lights at night on my car because I'm endangering other people. So as long as you're not endangering other people, yeah. But it's really tragic that young people should be dying. If I'm 80 plus and I die, I've had a good life. Even at this age, if something happened to me tomorrow, I've had a fantastic life. I wouldn't, I'd be fine with it. But at when somebody is, 10, 15, 20, 25 years old, 30 years old and dies, that's really tragical. Hey, Brian, it seems crazy to me to quarantine 99% of population because 1% is sick. Yeah, but there is also that's a good point, Brian, because there's a consequence to all this, and the consequence is when people have been in the house all the time, there will be more violence. People are losing their jobs, so there will be more suicides, more depression. Yeah, like I said, more violence, and just more divorces for that matter. So now children are growing up in single parent homes, which is not healthy. That's been proven statistically. So I just think there are a lot of consequences to this, both short term and long term, that are not captured statistically, that can be really bad. Capron says they should start counting people who die within 28 days of receiving a vaccine. Yeah, I don't know how many vaccines they've put in people's arms so far, but I think the amount of people who will die of the vaccine will be much, much less than the people who die of the corona. Let me put it this way: if I could take the American vaccine or the British vaccine or any vaccine developed in the West, and be able to travel as I want to from island to island to Malaysia and everything, I'd put the vaccine in my shoulder tomorrow. That's how desperate I am to travel, man. Brian says people should be able to decide for themselves. Yeah, knowing the consequences, basically. Yep, that's kind of where I'm going with this. I mean, if you should be able to decide for yourself as long as you don't live with somebody who's older or someone who has underlying issues, obviously, because then you're taking a chance for someone else. How has the pandemic affected your retirement savings? Um, well, my retirement savings have actually increased. Yeah, from yep, they've increased. So, but that's the stock market. It goes up and down. Hopefully, it keeps going up, but I'm afraid it's going to crash soon because it'll probably go down a bit before it comes up again. People are very optimistic about the future, and I think I think once the whole world gets vaccinated, there'll be a lot of pent up demand for travel, for products, for services. So I think it's just going to take off. I know the oil industry is going to take off once this starts going because, for example, producing oil. Um, yeah, I won't get into the technical part of it, but with oil production, it takes a while from the planning phase to the production phase, and with all the cutbacks in the last year and a half, uh, they really haven't started drilling because the prices aren't there yet. And when the prices get there, that's when they start planning and drilling, and that at that point, that pent up demand will increase and increase. So prices, I I bet you by the fall you'll see oil prices of 75 plus per barrel. There's scary news stories of people dying in China of a new virus that's 75% more deadly than COVID. Now, when you say a new virus, are you talking about a variant of the COVID or a completely different virus? So yeah, I think the Chinese need to pay compensation to a lot of countries for this whole damn thing. It's because of them. I mean, if they had said the truth right from the beginning of what this was and how bad it was, the effects of the virus would have been much less than the effects we have today. According to the latest WHO data published in 2018, road traffic accidents deaths in the Philippines reached 10,624, or 1.7% of total deaths. The age adjusted death rate is 11.4 per 100,000 of population. 10,000? Yeah, that might be what they're reporting, but I can almost guarantee you that that's not right. Because the reason I say that, I think in the US we have approximately 30,000 deaths, and we have 330 million, and here they have 110 million. And there's no way we have the same percentage of death here as in the US. It must much higher. I've already seen, what is it, 2 or 3 dead people here in motorbike accidents. So uh, in the US, I don't think I saw one. Yes, I did see one person died in an accident, and that was over a period of 20 plus years. So, and I drove a lot due to my job. So I just don't believe that statistics. Um, the Philippines is not very good at keeping track of everything, I believe. So that's just my theory. I wish it was better, but I just I can't see that the death rate here would be the same as in the US. I just don't see it. Jim Bird says, "Howdy, Paul and Mia." Hey, Jim. The PCR test is widely inaccurate, and quarantine based on that are crazy. You know, somebody else had said that, Brian, and I looked it up. I believe I Googled it, and I think it was, if I remember correctly, it was pretty accurate, or maybe it wasn't the PCR. It's one of these swab tests that they did that was what it said on Google. Uh, if you believe that, was that it was pretty accurate. So if you have a link that shows that the statistics of that, that would be great, Brian. Your last video, you sure seem pissed. Lol. Yeah, I'm pissed of this whole lockdown. I'm ready to travel, man. Bamse Moy says the so-called new strain is to scare people to take the vaccine. Yeah. You know, people say that, and I'm, guys, I'm an engineer, so I like to base stuff on actual evidence, statistics, and data that I can read or research or something. But that might be the case, or it might be that there's actually a new strain. But I've been saying it all along. The whole last year, I've been saying that this thing is going to mutate, like any other virus. It's going to mutate. Obviously, when it jumps from one person to another person, it mutates. So sooner or later, we're going to get a new type of virus, and the vaccine is not going to kill that virus. So they're going to have to come up with an amendment, if you want to call it that, or uh, change the vaccine somewhat. They do the same thing with the flu vaccine, right? Every year they have hundreds of strains, if not thousands, So they have to go through all of them and try to predict what's coming this year. So it's going to be the same with the corona vaccine. I think it'll be a yearly shot. So that's my theory. Brian says doctors have been instructed to record all deaths under COVID now, whatever the primary cause. More money for COVID deaths. Yeah, I've also heard that, but I haven't been able to find that um, like any place. If you guys have links to anything, I really appreciate it. I'd like to read about it more. So, um, PL, one of my frozen pension funds is up 8% from 1 year ago. Caprian, what do you mean by frozen pension? You mean like your 401k or something? Yeah, I mean, you look at the stock market, it's going crazy, but again, you look at the evaluations, the PE ratios and all that. It's like, I don't know. I just, it seems, yeah, the stock market seems overvalued. It seems to be hyperinflation going on in the stock market right now. I've, I'm probably 60% in stock and 40% cash now. So I'm slowly going back in, but it's real slow because I'm afraid of it'll crash again. So, uh, Paul, be honest. Are we now looking for at Q2 at normal arrivals there? I'm always honest, Rob. I, my prediction is as good as yours, man. But I think you have to look at the Philippines will follow what other countries are doing. If, for example, you see Thailand opening up, if, for example, you see Vietnam opening up, Philippines will open up shortly thereafter. Another thing you have to look for is for domestic travel to open up. Yeah, they say domestic travel is opening up now, but no one's going to go for a 3-day vacation and have to take a swab test, sit in quarantine for 7 days. They're just not going to do it. So when things normalize here, where you can travel from one island to another, I think that's a really good sign that we're going to open up. If I was going to guess, I would say towards the end of this year, it'll open up. It could be before, but I'm guessing the end of this year because the economy here in the Philippines, it's really bad, and it's going from bad to worse. So hopefully they they open up. I mean, I can't see why they wouldn't open up for people just with the swab test and go from there. And especially with countries with low rates. Obviously, that wouldn't include the U.S. It wouldn't include the UK, but it could include countries like New Zealand, for example, Australia, and other countries with very, very low percentage of corona. Yeah, Brian is right. Dimitri says, yeah, Brian is right. These rules and lockdowns are crazy. Instead of protecting old people, they lock kids, which are not in danger at all. Yeah, and the psychological damage from these kids for these kids is it's enormous. I read, no, I didn't read it. I heard it somewhere on the news that the amount of suicide rates or suicide attempts for young people have increased dramatically in the US. And I just think this lockdown, kids, they have more of a need to go out than we do. I mean, we can sit and watch TV and read and do a lot inside. But kids, I remember when I was a kid, I needed to go out. I'd go crazy if I sat inside. So um, anyone who's had kids will attest to that, I'm sure. Brian P says UK has a waiting list of 4 million people, even cancer and heart patients who are not being treated beside COVID patients are prioritized. How many of them will die? Estimate 40,000 have died at home. Brian, you have a really good point there. I've also talked about that, is that not just the people with cancer, but think about people who don't have cancer that do a yearly checkup or every 2 years. Let's say me, I haven't had a cancer checkup in 2 years now. And if, for example, I was supposed to do it last year, but I couldn't do it because of the coronavirus. So I'll say I'll do it when the corona's done, and then I go to the hospital and they say, "Yeah, you have cancer, but it's too far spread. You'll be dead in 6 months, right?" Will they count that as a consequence of the coronavirus? No, but it is a consequence of the coronavirus. And think about people with heart issues and all the other issues that they work on in the hospitals. So yeah, it's that's I mean they need to include that in the pandemic deaths, right? Because they're and that's a really good point. That's a really good point. Mr. Vega says people on 5 or 6 prescriptions walk around thinking they are healthy. If you need that many meds, you are not healthy. You're a time bomb. COVID is just lighting the fuse, but don't blame COVID. Yeah, you got a good point there. Like my mother, she's on 10 different medications. So, yeah, that's a really good point, Mr. Vegas. Can you still go today to Taiwan or do you have to have a shot? I have no idea. I'll take that bet against 75 oil. Okay, Mr. Vegas. Send me an email afterwards. Tell me how much you want to put on that bet. There has been so much oil gas demand destruction worldwide that might never come back to the market. But that's the thing I'm getting at, Mr. Vegas, that there has been a destruction of the oil and gas because of COVID. And once that picks up, the production is not going to be there. That's why the prices will go up. But we'll see who's right. Log on in the fall, Mr. Vegas. Grayman says the Chinese government doesn't care about their own people. Why would they care about the rest of the world? Yeah, really true. I don't expect them to pay compensation, but I think the United Nations and the US and the rest of the Western world needs to go and force them to pay it or, put sanctions on them. GI says, Paul, I look at it this way. If it's my time to go, I'll go. I figure, Rich, when your time is up, it's up. It's up no matter what you do. Yeah, true. But you do take safety precautions, right? I wear a safety belt when I drive a car or a helmet when I drive the motorbike. So I try to minimize my chances of dying. The new virus is called Nipah. The BBC has a news article about it. Oh, so it's not. So it's not a. So it's not a coronavirus mutation. I'm guessing since it has a new name. But it's not only the virus if it's how deadly it is. For example, SARS was a lot more deadly, but it wasn't as spreadable. The problem with coronavirus is that the spreadability, or what they call the R naught value, is very, very high. So, yeah. Nipah virus. Oh, God. Why do we get all these viruses from the Chinese? I'm just reading here real quick. So, it's mostly in animals, but has gone to humans as well. Most human infection resulted from direct contact with sick pigs or their contaminated tissues. So direct contact, basically. Yeah, but all these viruses are scary because, like the Nipah, it looks like it's probably the spreadability probably isn't that high, but like any other virus, it mutates, right? Because it tries to survive. So, yeah, the world we live in. Brian, do you have an email address that I can send to Paul? Yeah, if you're on a laptop and you go to the About section, you'll get my email there. I'm ready to travel as well. I took the first shot of the Moderna Friday. So, how did you feel after the shot? I hear some people get headaches and a bit of aches in the muscle for a couple of days. Brian says the World Health Organization has instructed testers to adjust the sensitivity of the test as it is giving false positives based on dead virus debris from past cold and flu virus left in the nose. Okay. This won't be the last virus outbreak. Of course not. There'll be more to come. Hopefully not in our lifetimes, but there will be more. With the world becoming more populated, they are going to be more frequent. Yeah, that is true. That is true. Maybe it's nature's way of trying to keep the population down. Brian says, Paul, there's so many videos on YouTube about all this stuff showing verified test results. Yeah. The problem with a lot of YouTube videos is just people's opinions, and some people make stuff up. And I like to actually read stuff from, reputable websites and research papers and stuff like that, just to get the scientific view on it. All I see is the Philippines vacillate when the wind blows every 2 weeks. They come up with a new plan. Yeah, that's really true. Sorry, I'm laughing because I live here. It's just like so true. What Greyman is saying there is so true. It's like every second week there's something new. there's no, there's no like scientific. Maybe there is. I don't know. Maybe there's some data or science behind it. I shouldn't say absolutes, but it doesn't seem to be, because they give no logical reasons why they're doing what they're doing. It's just like, oh, we feel like it today, so we're gonna set this new rule. It's just, I don't know. But they have done they have done good, because when you look at the amount of corona, at least what's reported, it's very low compared to other countries. So I'll give the Philippines that. They have done a wonderful job. And I think the reason is the social distancing, the mask wearing. I mean, people wear masks here religiously. People wear masks when they're driving the motorbike without a helmet. Like the mask is more important than the helmet. So this is how serious they take it here. Capron says an elderly relative fell and broke his knee. He went into hospital and caught COVID in the hospital and died of it. Yeah, that happens also. That's yeah, that's sad. Roy says Taiwan is completely closed to tourists. Jim says oil is going to 100 plus per barrel now that Biden is in office. Watch. Well, it's not, it's not. Well, oil is a world commodity, so it's based on oil prices. I mean, on what's available in the world. It's not what's just in the U.S. Now, the U.S. has a substantial influence, since we produced, I think it was 10 to 12 million barrels um, per day, and the world production was. I'm trying to remember these number, guys, but I think it was 90 million per day. So I think we produced like almost a tenth of a bit more than a tenth of the world production. So it has some influence, but not that much. Mr. Vegas, there might be a short-term oil gas price spike as the past COVID economy ramps up. So maybe I spoke too soon, but much of the demand destruction will never come back. When you say demand destruction, I'm assuming you're talking because we get wind and solar and other alternative energies coming, and um, a lot of the car production is going to electric. But still, you got to look at it this way: the population increases, the energy demand increases, and it's not going to be oil or solar or wind. It's going to be a combination of everything to keep up with the demand of energy. Wandering Doc says, "Hey all, good morning, Wandering Doc." Bamsimoy says, "How much death and misery do you think loss of job and business will cause because of the lockdown on the long term? Study the Great Depression if you're worried about the stock market." Yeah. Um, the first part of the question, I would say we kind of talked about it. Yeah, I know what you're saying there. I think the consequences of the lockdown are enormous. both in death and psychologically, short term and long term. So I agree with you. Ricard says, sorry, Paul. I think something in the live stream doesn't allow links to be sent. I tried twice. I could see it on my end, but couldn't. Probably a security thing. Yeah, maybe. Um, could you email it to me? That'd be great, man. Or yeah, if you're on my Facebook, just message it to me. No problem other than a sore arm. Yeah, Jim got the first shot, and he says no problem except a sore arm. So that's kind of what I've heard. Sore muscles for a couple of days, and some people get a headache, and that's about it. So David Smith says, I work for medical department to see true stats. Except for medical facilities not being able to handle number of patients, numbers don't verify lockdowns. Under 5% of all elderly who get it die. Under 5% of all who get it die. Actually, the statistics say that I think it was 15% of those over. Of course, now I can't find it. Let's see. Had it here, right? Damn it. Anyway, I seem to remember it was 15% or something um, of the people over 75, I believe, that died, which lasted about 12 hours. Jim says, yeah, the muscle ache lasted about 12 hours. Yeah, it'll vary from person to person, I'm sure, but yeah, about a day or two sounds right. Overall, David Smith says, overall, under half of 1% in USA. I'm in California. Lockdown for basically 1 year has destroyed businesses. Yeah, a lot of business. And the worst thing is most of the business being destroyed are the mom and pops, the small businesses, and that's really, the big guys manage, and the big guys get all the tax cuts and money from the government. Is the small guys that, the people that have, maybe less than 10 people employed that go bankrupt because of this. David Smith, ruined lives, major suicide, yet percent people getting stays the same. Also about the same number of normal flu deaths as the COVID. Crazy. Yeah, I disagree with that last part. I think COVID is much more deadly than the flu. From the numbers I've seen, the statistics I've seen, it's about 10 times more deadly than the flu. But still, uh, is it worth the consequences of the lockdown? I think probably not. I just don't know why they approached it that way. They should have approached it, looking at statistics and data. They should approach this in a scientific way and say, well, if you're under 50 and you have no underlying issues and you don't live with anybody who is vulnerable, then you should be able to go out to work. You should be able to go out and go to a restaurant and so on and so on. Just putting everybody under the same category is just stupid, in my opinion. Um, Dimitri says, Jim, why should oil go up due to Biden? I thought Sleepy Joe wants some kind of green deal like the EU is doing. Why should the oil go up? Well, the oil is going to go up because of pent up demand, um, and also they're not. The thing with oil is you don't just drill a well and it just produces forever. There's a certain type of incline, depending on the type of rock. Sometimes the incline is much steeper than um, other rocks. Like for example, in the US, the incline is pretty steep. So they have to keep drilling these wells to keep production up or to increase production. And during the last year and even now, the amount of wells drilled are minimal. So they can't keep up production. So production is going down. So once the the pent up demand comes in, um, the lag of from starting to drill new wells to production is at least 6 months to a year. So it's going to take time for them to to produce to meet that pent up demand, and that means that oil will go up. So that's why oil will go up. In the long term, yes, you're right. The need for oil will go down, but that we're talking long term, really long term. David Smith says, "I have a job, but see idiots running this thing." Yeah, we can all agree on that one, I think. David Smith, and you're right. Any vaccine will not work because virus will mutate and keep mutating. Only herd uh, mentality has ever worked in history for viruses. Um, yeah, well, I think the vaccine will help us get herd immunity. Um, so yeah, Captain said, I heard the IMF said they would withhold funds from the Philippines if they did not lock down. I never heard that. Not saying it's not true, but I never heard it. Who knows? There's always these backroom talks, right? So no one really knows. Not YouTube videos from people from scientific organizations and the world leading virologists, sorry, who have run proper clinical studies. Oh, okay. Yeah, it's a pity we can't. Maybe it's something in my settings that make it so we can't put links. I'm not sure. I'll have to look into that after this live stream is done. Hey guys, I'm gonna go on for about 10 more minutes, 10, 15 more minutes, and then I gotta take off. I'm meeting some friends for coffee, so I'll um, I'll go on to, let's say, 8:45, then I'm out of here. David Smith, you talked about Philippines changing as wind blows. California, USO, idiots governors doing the same. Stats don't back him shutting businesses, but I know over businesses never to reopen because huge debts now. Government does not care. Yeah, all these poor businesses have a lot of debt, and some of them are not coming back. That's for sure. Yeah, that's for sure. It takes a while, but hopefully, hopefully it'll end by this year and we can go back to normal life. Uh, Grayman, I told someone today I feel like Philippines gives their COVID risk mitigation decision to fifth graders, and they were the ones to come up with the shield on the motorbikes. Actually, I think fifth graders would have done a better job. Sorry, you know. David Smith, they only want to appear to care, so they hope they get reelected. Crazy, but my parents in '90s got it, high fever, but in good health, so recovered 100%. Yeah, true. Some older people do recover. They don't all die. I think it's at 15%. So David Smith, if in good health and under 70, almost always recover. 100% true. Look up stats. Yeah, if you're in good health, no underlying issues, you have more chance to not have serious issues than, let's say, someone who's in their 40s or 50 with underlying issues. So that's absolutely true. Roy Goad, my brother has had the Pfizer vaccine and my sister the AstraZeneca about 3 weeks ago. No side effects at all. All good. Fantastic. That's good to hear, man. They are both in their late 70s. Hey, Scott. Most people say the Great Reset is a conspiracy, but it is right on the World Economic Forum website. Yeah, I keep hearing about this reset, and I'll have to read about that, but I'm not sure what that entails exactly. What are they trying to reset? Um, but I'll have to read that. David Smith. No, I mean Grayman says at David Smith, amen to that. I run a business in Texas and California portion is shattered as I'm in a private investigations. Yeah. Brian says, Paul, you have seen the ivermectin treatment results. It's been very successful in treating and curing COVID in various clinical tests. Now, more countries having a trial now. I haven't heard of that. What's it called? Ivermectin. I'll have to put that in so I can read about it. Ivermectin. So let's read about it after this. Livecast. Jim says, Dimitri, he just canceled the Keystone Pipeline, which cost Canada billions of dollars and 11,000 US workers their jobs. Not going to allow any drilling, supply, and demand. Yeah, he canceled the Keystone pipeline. So, and he canceled drilling on federal land, leases that weren't leased already. So that that is true. But you remember, this is the U.S. So U.S. only stands for about 10% of the production of the world. So it doesn't mean um, you still have other countries producing 90%, and many of these countries will pick up the slack for the U.S. Jim says Canada is pissed. Yeah, rightly so. Rightly so. Um, this is something I feel. This is politics, not the corona, but in the U.S. we have elections, right? And then we'll have one president to the next president to the next president, Republican, Democrat, or Democrat, Democrat, Republican, and so on. So we always have shift, but I feel like one president should respect the the agreements of the previous um, president and Congress. I just don't think they should override it. I felt the same when Trump overrode the Iran agreement, and I feel the same with this pipeline. I think it puts the U.S. in a bad situation where people can't really trust the agreements, because if I'm another country and I make an agreement with the current people in power, and how do I know 4 years from now if it's not a new, like, if the Republicans don't take over, that agreement will be canceled, and then 4 years from now, after that, Democrats take over, and that agreement will be canceled. You know what I mean? There has to be some consistency, but I'm getting off topic here. Sorry about that. Thank you so much, ATEC. Appreciate it. Appreciate that you like the streams. Thank you. Roy Good says the main reason for lockdowns is to keep the hospitals from being overloaded with patients. Yeah, true. True. But that's another thing. I know that, and I think most people know that, and know that the hospitals are full. And if I decide to go out and get this virus, that's a chance I'm taking. And if I go to the hospital and they say there's no more hospital beds, well, that's a decision I've made, and I have to suffer the consequences of that, right? So, Paul, can you see who thumbs up your videos? No, I can't see who thumbs up or who thumbs down. So, yeah, I can't see that. I'll say good night now. It's 12:30 in the UK now. Thanks for the chat, Paul. Have a good day. Thank you, Brian. That was the last comment, so I'll just go ahead and wrap it up anyway. I was supposed to go to 8:45, but anyway, guys, it's a great discussion, and thank you for all the tips about the different viruses and medicines and all that stuff, because I'm going to read about it when I get back from my coffee in the gym. So anyway, I hope you enjoyed the live stream, and I'll see you on the next one, which will probably be next Monday again. I'll try to keep it on Monday about the same time slot every time. So I might start doing 2 live streams a week, depending if there's any topics to talk about or not. So, um, so Scott says, enjoy your coffee. I will. I'm meeting some other vloggers, so it's always fun to get input from them also. Ed says, thanks, Paul. Thank you, Ed, and have a good day. David says, first time listener, like your mellow style, will listen more. Thank you, David. Thank you. Yeah, I'm not one of those screaming types. Steve says the worldwide death tolls have remained relatively constant for the last 15 years, only varying around 25. Is it 250 or 25,000? 25,000 per year. Yeah, okay. Uh, like my friend who is completely against the lockdowns and doesn't believe in this corona, he says, people are going to die and people are going to be born. When it's time to go, it's time to go. And he has that attitude. I stay healthy, I exercise, I eat healthy. And if I get corona and I die, well, that's on me, he says. But I don't want to be locked down. I want to do what I want to do. And the older you are, I think the more apt you want to not be locked down because you don't have that many years left, right? I mean, if you're in your 20s and you get locked down by a year, it doesn't seem like a big deal. But my God, when you're 60, 70, yeah, percentage wise, it's a big deal. Anyway, guys, uh, Jim says, first time listener, like your style. Thank you, Jim. Thank you. Anyway, guys, I'll say bye for now. And thank you for everybody for joining. And I'll see you next Monday. And I'll be releasing some videos in the next couple of days. One of them will be about uh, um, how to hold your frame in a relationship, specifically under these lockdowns. And then the other one will be just a motorbike ride going to Tambobo Bay, which is about an hour away from here. So thank you. Bye bye.